an infection that is largely an outcome of rural poverty. In fact, malaria in some cases could cause great harm, in severe cases could lead to death. Today, our focus on HealthWatch is on malaria. Plus, we bring a feature on hand hygiene, the importance of hand hygiene. WHO says that hand hygiene is a typical activity in achieving universal health coverage. My name is Nkem Okibe. Welcome to another interesting edition of HealthWatch. So stick around, we'll be right back. If you're just joining us, the program is HealthWatch, reaching you on the station for excellence NTV Lagos Channel 10. Today's focus, like I said before we went on the break, is on malaria. And my guest today is a family physician. Trust me, he has treated a lot of cases of malaria. For the past 30 years, he's had patients come down with all kinds of malaria. Today on the program, my guest is Dr. Taiwo. You're welcome to HealthWatch.
Thank you, Ma.
Talking about malaria, let's look at what are the major causes of malaria. And because we find ourselves in a climate where if you see anyone that has high fever or has headache, person just concludes, I have malaria. He's not gone for any test. He's not been, he's not seen any doctor. He's not been diagnosed to say, oh, you have malaria. So what are the major causes of malaria?
Thank you very much for this opportunity. Malaria is the commonest outpatient condition we see in our clinic. And just like you said, in Nigeria, once you have headache, you have fever, body pains, being a tropical environment country, and we believe malaria, the organism that causes it, thrives more in tropics and subtropical countries where temperature is very high. Malaria is caused by a parasite called Plasmodium that is transmitted by the female Anopheles mosquito, which breeds so much in our environment, tropical countries and subtropical countries. And as you said earlier on, it's a life-threatening condition. It's the commonest outpatient case you see everywhere, both primary, secondary, and tertiary institutions. And like in Nigeria today, malaria, people come with malaria. The first symptom is always high temperature, that is fever, headache, then body pains, vomiting, nausea, diarrhea in children, abdominal pains. But one thing that we discover even in this environment today is that people tend to misdiagnose, or people tend to go for typhoid treatment before malaria. We discover that people come here, they'll tell you they're taking treatment for typhoid. That doctor, oh, I think I have typhoid. Why typhoid first? Because they don't really know the cause of typhoid, they know the cause of malaria. But today, I believe, with more awareness, we let them know that malaria is commoner, much more common than typhoid. So, in summary, malaria is a life-threatening condition. It can kill, and it kills. Like WHO says, one child dies of malaria in every 2 minutes. 2 minutes, a child dies of malaria. In Nigeria and all over where malaria is common.
You talked about the causes and you also mentioned the signs. It's a burden when people sit at home and assume they have this particular illness and go to the counter and get the drugs for themselves. Now, the question is, what will be the first aid treatment you give out, especially to children? Because you just mentioned, you talked about a child coming down with malaria, and you also talked about the fact that it kills. It could kill. Now, what would be the first aid treatment you give to a child, or even an adult, if you feel these are signs of malaria? Especially the fact that people are confusing malaria and typhoid. Typhoid is not our topic today, it's more malaria. So, what would be the first things you should do before you see your doctor? Probably you're out to work, your child is at school. What are the things you should do first before you get it?
Thank you very much. First and foremost, once a child or adult presents with fever, especially children, young children, to prevent convulsion, we advise our mothers to tepid sponge them So get towel, soak in water.
Okay.
Lukewarm water, not hot water, lukewarm.
Okay.
Soak the towel in it, then damp the child's head down. Rub the child, then especially children.
Okay, what about if the child is in school?
In school, I think the school authorities, I believe in every school authority, they should have a first aid box.
Okay.
Where they must have at least some analgesics, syrup and tablets for the children. So whenever they see a child running temperature, fever, they should just first and foremost give the child that analgesic, either paracetamol or non-steroidal anti-inflammatory that will give. Then call the parents. Then they will take the child to the hospitals. I believe every hospital, every school should have a clinic or hospital where they have retainership with. So when they come to us, the first thing that we expect to do right now is to take a blood sample and do a rapid diagnostics test. Call it RDT. Okay. Get a sample. It's a side lab. It's a side room lab test. What we can do easily. Within 20 minutes, the result comes out. So you get once you discover malaria, then we start treatment. Okay. We don't just start treating for malaria because several things can cause fever in children and adults. So the WHO standard now is that every child that comes or every patient that comes to the hospital gets a blood test done. Good. Get the blood test done. We call it the RDT, Rapid Diagnostic Test, which can be done even at home. But we don't, for now, we don't advise that right now. Just come to the hospital, we'll do it for you. Once it reads positive for malaria, treatment begins.
What would you say, what's your take on a situation where someone has been treated for malaria at the beginning of the month? For example, you are in the month of May, at the beginning of the month, you get treated for malaria, it goes off, you're fine, you understand, and then after 2 weeks, you have the same symptoms, exactly the same symptoms you had initially, and you go for a test, and they also say you still have malaria. Does it mean that malaria takes, how long does it take for you to treat it?
The conventional treatment we give here is 3 days. Okay. 3 days. Most of the ACT, we call it the artemisinin combination therapy. Okay. Artemisinin combination therapy. We call it ACT. That is the WHO recommended use of malaria now. Okay. Drugs for the use of malaria. Okay. So once you give that, 3 days, most of them is 3 days. The commonest, the ones we use, is just 3 days. Day 1, day 2, day 3. If you look at all these drugs in the market today, all the drugs that have been advertised, most of them 3 days treatment, 1, 2, 3. So by the 3rd day, we expect that the patient should be cured. So when it reoccurs? So if it reoccurs, good. Then we need to think of either resistant malaria, or lack of drug compliance, proper drug compliance. Probably the patient did not take it the way it has been taken. Some take it the first day, the fever comes down, and they stop taking it. They say, oh, yeah, okay. Some say, I don't like taking drugs. Doctor, drugs, this one causes me to vomit. I feel nauseated when I take this particular type of drug. I don't like it. So after taking the first 2 days, I felt better, I started work. So, as you said, 2 weeks, 2 weeks, 3 weeks, you're back.
So that brings us to our next question. Are you now saying that there are different types of malaria?
Well, like malaria, from what I know, we have 5 types of malaria. That is caused by the organism. As I said, the organism is a parasite, Plasmodium, that the infected person, the malaria, the life cycle. If you look at the life cycle of malaria, an infected person, the mosquito, which is an Anopheles mosquito, bites an infected person. The malaria goes through the Plasmodium goes through the life cycle changes in the body of the insects that now bites another person and introduces the Plasmodium into another person. So that is how malaria is. So the organism causing it now, we have about 5 types of organisms. We call it, one is the Plasmodium falciparum, Plasmodium malaria, Plasmodium vivax, Plasmodium ovale, and Plasmodium knowlensis. But in this environment in Nigeria, I think we have more of the falciparum and the malaria.
We'll go on a short break now. By the time we come back, you're telling us what's this myth about a particular genotype usually has malaria? For example, we have the AA, we have the AS, and people say people that have AA, most times they have malaria. Telling us that we'll come back on the short break. We've got a short break now. HealthWatch continues after this time out. Stay with us. Welcome back. The program is still HealthWatch, and the topic is on malaria. Dr. Taiwo Oke is still in the house. Before we went on the break, I was talking about the myths around some form of some kind of genotype constantly having malaria. And I give an instance of the AA and the AS. And most times find out that the AA usually they come down with malaria. What's the connection behind that?
The issue has to do with the red blood cells. If you look at the life cycle of the malaria or the parasite in the body of man, once it gets infected, mosquito bites the human body, it releases the sporocytes into the blood. So it carries it from the blood stream to the liver. That's the life cycle.
Okay.
From the liver, it stays there for some days. Then from there, it goes into the red blood cells. It attacks the red blood cells.
Okay.
That is why some of these symptoms of malaria could be anemia, because the parasite attacks the red blood cells and breaks it, destroys it, and to release it to the blood again. So that one comes as chills and fever. So when somebody has chills and fever, at that period he's having chills and fever, the malaria, the parasite in the red blood cells is being released into the blood. So we discovered that in AS or in SS, AS, SS, AS, and AA, that is the genotype, the commonest genotype. There's this protective wall among carriers, that is the AS. It's called the AS women really come down with malaria. Oh. That is AS especially, really come down with malaria. All because there's that myth that the red blood cells the parasite does not find it difficult to invade the red blood cells. So when it gets to the liver, it dies there. So it doesn't invade the red blood cells. There's a protective wall, according to research, for carriers. That is SS, sickle cell carriers, AS.
Wow.
But for AA and sickles, SS, they don't have that protective mechanism.
Thank you so much for giving us that clear explanation, because that's been like something to talk about, especially amongst people that are AA and AS. They're like people that have AA, especially children. You see them coming down with malaria all the time. Like almost every quarter of the year, they're having malaria. Moving on, let's talk about the theme for this year's World Malaria Day. The theme was Zero Malaria Starts With You. And if I were to ask this question, one of the things I want to talk about is, if a pregnant woman needs to get tested, she could get her kits at home and get the kits. And of course, the kits is a place it shows you positive or negative. Of course, you can't treat yourself. You can't even attend to yourself. Of course, you now know that you need to go to your doctor for antenatal care. Now, if you talk about zero malaria starts with you, what comes to my mind is there a way that this kits could be provided so you could just do a simple test? Because you find people treating themselves for malaria even when something very severe is happening. You just say, oh, I have headache, oh, my fever is high, so I'm sure I have malaria. So what is the way forward with that kind of thing for this year?
All right. The thing is, as you said, zero malaria starts. So that word zero means malaria can be eliminated, eradicated. It can come to zero level. That is what that zero means. And when it says starts with me, this is what it means that everyone has a role to play. Everybody, the society. So it has to lead more to awareness. So we can end malaria in Africa. We can end malaria in Nigeria. It is possible whereby the rate now is so much. Between the past 2-3 years, WHO statistics, the CDC, the Center for Disease Control and Prevention, still believes malaria is still thriving much in Nigeria. Later we're going to talk more about the causes or most of the risk factors. But as you said, Zero malaria start means it's just like this year they are telling us that everybody has a role to play in the eradication of malaria. If only the government, if only the churches, the mosques, and everyone knows how it is caused, the way it is transmitted, how it can be prevented, the various preventive measures that government is doing, like provision of insecticide treated malaria nets, mosquito nets rather, mosquito nets that is being provided. If everybody is giving that, our environment, stagnant water, if we can do away with it in our environment, environmental sanitation, personal hygiene, insect repellents, then avoid indiscriminate use of drugs. Go to your doctor, they give you your drugs. Then the kids, as you said, can it be give it to everybody, especially our pregnant women? Well, it is possible, because though you have to teach them how to get blood from themselves, because the kids, you have to take blood from yourself.
Okay.
You have to prick yourself. So if they can teach them that, then dip the blood into the kits, then teach them how to read it. But to me, it's still, if only we can assess our health, assess the various hospitals, your healthcare provider, you can easily assess them, especially in the rural areas, fund them properly, tell the people once you have malaria, please, or you have anything that is making that you feel you are not feeling fine, especially the pregnant women and the children, infants. Go to the hospital, everything is there. Every hospital has the RDT now. It doesn't cost much. Take your blood and you are treated for malaria. So zero malaria starts with me. It's just telling us that we can eradicate malaria if everybody, man, woman, adult, child, rural area, local government, state, at level, everybody, society is aware of it and makes up their mind and be determined and take all the precautions, all the precautionary measures to prevent it.
Are there new research on malaria? Is there a vaccine on malaria?
Well, research has been going on for years. Malaria is a parasite. The organism causing is a parasite. And it's not a virus, it's not a bacteria, which like you have so many vaccines now, immunization going on. But because most of the organisms are virus, bacteria, so they're able to discover vaccines for them. But for malaria, because of the nature of the organism, I think over the years it's difficult. But of recent, we discovered that there was a pilot study in Malawi, East Africa.
Okay.
I think early last month, we were in May, April, that they discovered a vaccine for malaria. And it's been tested, and we heard that there's good progress going on. At this, they discovered a 60% reduction. There is 60% reduction in malaria cases in Malawi.
That's good.
And they are now taking a pilot study.
A follow-up research.
In Kenya, Ghana. Some say, why not Nigeria? I would pray they come to Nigeria.
Okay, doctor, very quickly, in 1 minute, please. Very quickly, we're about to round up. Tell us, what's your advice based on today's topic? What's your advice?
It starts with you. It's a team that we should all educate our people, educate our populace. Let them do that. If you have fever, if you have headache, don't conclude it is typhoid. In my practice here, and in the practice of many doctors, we discovered that a lot of people treat themselves for typhoid before coming here. They would have said, oh, once they have fever or malaria, it is typhoid. Let us let them know now that please, if you have fever, headache, chills, don't conclude it's typhoid. Go to your nearest health provider, get tested, then you'll be treated. Malaria is easy to treat. Thank God for that. It's curable. Very, very curable. That is one. Two, please, our own environment. Our environment. How is your environment like? The bushes, the grasses, stagnant water, the gutters, do you clean it? The environmental sanitation we do, you have to wait once a month to do it. It should be a daily thing. Get the mosquito treated nets, it's available. get insect repellents, it's available. Then your diet, try and eat well. Eat well so that you can have enough immunity to combat it, because malaria causes anemia. And so that if you suffer malaria, the red blood cells that have been destroyed will not cause you to go down to the extent that you collapse.
Wow, what an interesting package. Thank you so much, Dr. Taiwo. Okay, you've said a whole lot. I'm sure that if I let you go, you just keep talking on and on, a lot of things to talk about on today's topic. Thank you so much for coming on the program.
Yes, I'm grateful. God bless you.
Moving on, up next is a feature on hand hygiene and the hand washing techniques. Have you heard that before? Do you know how to wash your hands properly? Find out in this feature.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow-operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
That's an interesting feature on hand hygiene. It just reminds me of what children do when you get them to wash their hands and when it's out. Just go ba 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 and they're out. So I'm sure you enjoy that feature on the hand washing technique. So you wash your hands, the two palms like that, your fingers, your knuckles, the tip of your tip of your fingers, your knuckles, your wrists. And that wraps it up on this week's edition of HealthWatch. We'll talk about a whole lot of things, malaria, hand hygiene. Join us again next week. But before then, if you have questions, you have inquiries, you want to sponsor this program, send us a mail to keepingchem@gmail.com, HealthWatch NTA10@gmail.com. Send a text only to 07060865487. Thank you for being part of this week's edition of HealthWatch. See you next week. My name is Ken.